Some heart operations can now be done through tiny openings between the ribs instead of opening the breastbone. Robotic cardiac surgery is minimally invasive heart surgery. The surgeon controls thin robotic arms from a console next to the table. Instead of one long cut down the breastbone, the team makes a few small openings between the ribs on the right side. The robot does not make decisions. It translates the surgeon's hand movements into very fine, steady movements inside the chest. Robotic techniques are used for selected operations: mitral valve repair, single vessel bypass, some atrial septal defects, and certain heart tumors. A heart-lung machine takes over circulation during the operation. Tubes are usually placed through small cuts in the groin. Eligibility depends on the heart condition, lung function, prior surgeries, and chest anatomy. Detailed scans guide the decision. During surgery, small ports are made, robotic arms are docked, and the surgeon performs the repair from the console while a bedside assistant supports the team. Once the repair is complete, the heart is restarted, the machine is disconnected, and the small incisions are closed with stitches. Most patients spend 1 to 2 days in intensive care, then move to the ward. Total hospital stay is commonly 3 to 5 days. Because the breastbone is not cut, many people return to light activities and driving earlier than after traditional open surgery. Risks include bleeding, irregular heart rhythm, lung issues, and rarely the need to convert to open surgery for safety. In suitable patients, long-term results are comparable to traditional surgery, cardiac rehabilitation, and follow-up support, lasting recovery. Did you know? You can get this treatment abroad at the same quality you'd get in the US or Europe, for a fraction of the cost. Ginger Healthcare is one of the world's most trusted medical travel companies. It helps patients to find safe and affordable care in India, Thailand, Turkey, Singapore, Dubai, Malaysia, and more. Visit ginger.healthcare or check the description for details.